What if we told you that your all-on-4 treatment isn't just about getting new teeth? It's actually facial plastic surgery that can make you look 10 to 15 years younger or older, depending on how it's planned. Today, our prosthodontists at North Texas Dental Surgery are breaking down the 3 critical measurements that determine your final outcome: smile line, incisal edge position, and vertical dimension. You'll discover how these technical decisions control everything from your lip fullness to your wrinkles, and why the current lip filler trend is actually complicating dental treatment planning. And stay tuned, because we're revealing the delicate balance prosthodontists must strike. Too much bite opening and you can't swallow or speak properly. Too little and your face ages dramatically. Plus, we'll explain why they approach all-on-4 patients exactly like complete denture patients, and how this perspective changes everything about your treatment outcome. We now have given this patient options and they decide to go down to a all-on-4 full arch solution. We all know that you have to bring that patient in for initial examination, right? Where you get all the records. What exactly are you guys looking for when you bring them in?
First thing, if the patient is decided to go the all-on-4 route, the most important thing is the existing smile line. Smile line is basically how big is the smile window. When the patient smiles, how much do we see?
Right.
That dictates a lot of in terms of our placement of the teeth and then your placement of the implants. So because we definitely don't want a situation where you place the implants way too in the window, so that when the patient smiles, you can actually see the prosthesis and that transition line almost where the prosthesis hits the gums, right? Secondly, we look at the incisal edge position, which is just like where we want your front teeth to be. Because that's almost like the basic thing that we look at, where do we want the incisal edge to be, not just in terms of how far up or how far down, but also how far in and how far out.
Right.
Because that also will help and affect their speech, their function, their lip fullness, and all of those things. The third thing which we look at is the vertical dimension, which just means that essentially how much room does she have for the prosthesis. And we have to assess that, keep in mind that we have enough room to have her function, speak well, and most importantly, also have an engineerable space, so that at the end of the day, the prosthetic that's going to fit there has enough room to withstand the forces of the bite.
Right.
Because if we don't open the space enough, we call it opening the bite enough, you might end up in a situation where the prosthesis at the end, even the zirconia, is too thin, and even zirconia is too thin, like any other metal in the world, can fracture.
Right. Do you have anything to add on to that?
I think what prosthodontists are known for, unfortunately, is for complete dentures. But I think that when we look at the first time we look at a patient for all-on-4, we look at it like, where do we want the front teeth to go? Where do we want the back teeth to go? Just like how front, how backwards, how up, how down. Relate that to a person with day smile, because it's not the same if you smile like this, but if you smile the person's that's different. And also try to place the teeth in a position where they ever show a lot of count. We have to find the sweet spot, and at the same time have to open or close the bite. It's about how much separation to the upper and the lower jaw, because that has a direct influence on the facial aesthetics. So just by opening or closing more the patient's jaws by doing all-on-4, a patient can look like 10 or 15 years younger or older, because the more we open the bite, the more we separate the jaws, the patient looks younger because there's less wrinkles, the face looks younger. But sometimes some patients say, I don't want to show some length teeth, so we have to close the bite. That's what happens. The patient looks older because there's more wrinkles, and the patient is like, oh, why do you look older now? So it's very important when we do another for also lip score, and even nowadays that everyone gets fillers everywhere in the lips. So depending on how forward or backwards you want to place the teeth, that's going to have an influence on their lip. So we consider the amount of lip thickness, and we try to dip patients out with maybe wants to look younger. So we try to get them a beautiful, we try to open the bite in a way that we give them a younger periods. And nowadays everyone wants thick lips, so let's push the teeth out, but there's links, where. So we will always consider where the teeth have to go, but we that to the face and also to the patient's function, because we cannot open the bite like crazy, because then the patient will be like, I cannot even swallow, I cannot even talk. So I think that's very important, and that's what makes a difference in all-on-4, that we can only change not only the dental aesthetic, but the facial aesthetics.